Our next step is going to be analyzing cues or figuring out what could it mean. And the NCLEX might ask you this in a couple different ways. Either what conditions are they experiencing or at risk for experiencing, what disease processes could cause those findings, or how would I know if this or that complication was happening. So keep in mind that big picture problem as we go through this. So when I'm considering analyzing these cues, we're being asked, the nurse recognizes that crackles throughout the lungs in this client are due to either infective infiltrate, collapsed alveoli, or fluid accumulation related to either pneumonia, heart failure, or reduced mobility. And we're going to talk a little bit about how these findings might create crackles. Let's talk about crackles. And how many of you guys have had an opportunity to hear crackles either in clinicals or on a patient if you're already working? And if you have, you would know it's pretty distinctive, right? If you haven't heard crackles before, this is described as kind of a Rice Krispies snap, crackle, pop sound. And if you actually take a little bit of your hair and roll it between your fingers next to your ear, that's pretty close to what crackles sound like. And so this happens whenever it was explained to me, and I like to remember it as if you're blowing bubbles through a straw. So we've got gas, oxygen that's trying to come in, carbon dioxide that's trying to go out, but we've got something in the way. And that could be either infection, like pus in maybe pneumonia, or in heart failure or some other condition of fluid overload like kidney failure, maybe some fluid that's accumulated there, pulmonary edema, or even collapsed alveoli. So patients after surgery, for example, when they have this reduced mobility, they might develop atelectasis where their alveoli kind of collapse a little bit, and then if they cough or take a deep breath, hopefully they'll pop open. And so any of these things could cause crackles, but we have got only one that's most likely. And so I've asked you guys to kind of leave a guess. And all right, y'all have heard fluid accumulation from heart failure. That is kind of the consensus. All right, fluid accumulation of heart failure. Very good. So how did you guys know that? And we didn't talk about this yet, but yes, that S3 heart sound, right? This pitting edema in the lower extremities, those tell us he has too much fluid on him. So I agree that I'm very suspicious for too much fluids, for fluid overload. How would we know if he had an infection? So what other findings, because somebody who has an infection like pneumonia, they would be short of breath, right? But what other findings would we see that would tell us that it's related to infection? And I'm thinking something like, what about his cough? If he was coughing up yellow-green sputum, right? Maybe what about his vital signs? If he had a fever, or if we had lab results here, I might look at a white blood cell count. Yep, Faith says temp, Mary says high temp, yes. And so we can kind of rule out or recognize that that's less likely because he doesn't have a fever, yellow-green sputum. He doesn't have body aches or chills, or someone in his house isn't sick. We don't really have any clues for that. And then for the collapsed alveoli in reduced mobility, that's not impossible, right? He did tell us that he's been kind of fatigued, spending most of the day in the chair. But remember, when you hear crackles from atelectasis, they tend to clear with coughing. So if you hear it, you're not sure, maybe it's first thing 7 a.m. assessment, your patient's been taking slow, shallow breaths all night, you can just ask him to kind of cough, and that should pop open those atelectasis areas. But he's been coughing for 2 days now. And when I listened to his lungs, I didn't hear any absence of breath sounds over one lung field or diminished. There's just crackles. So let's look at how fluid accumulation from heart failure might cause crackles. And so just a quick review. So basically, if your heart is strained by any number of things, but this is most often hypertension, which our patient has, and coronary artery disease, which our patient also has. He's got stable angina. And so over time, that high blood pressure strains the heart, that kind of wears it out. And if you've got coronary arteries that have atherosclerosis in them, it's got a limited blood flow or blood supply. So we have too much demand for oxygen and not enough supply. And so over time, the heart gets weak and it can't pump blood forward as well. So because blood can't move forward well enough, your organs get less blood flow, and that blood instead backs up into the alveoli. And so this is what pulmonary edema is you've got fluid that's literally obstructing the ability to get oxygen in and carbon dioxide out. So that could definitely create crackles. And so we'll answer that, and we're correct.